Clinicians worldwide are familiar with Dr. Abbas Qutab and have benefited from his lectures, clinical knowledge, and leadership in the field of alternative medicine. Dr. Qutab holds medical, chiropractic, and Oriental medicine degrees, as well as a PhD in Ayurvedic medicine. He has extensive experience in developing postgraduate certification programs for physicians. He travels internationally and has taught thousands of physicians how to integrate alternative and complementary therapies into their practice. I'm excited about a seminar where he introduces a groundbreaking blood chemistry software developed by Dr. Harry Eidner. In this seminar, Dr. Qutab trains clinicians how to use blood chemistry analysis. I was fortunate to have an interview with Dr. Qutab before one of his speaking engagements. Of course, you're invited to attend an upcoming seminar, but here's some of the outtakes that will give you a taste of his wit and candor and why he believes this blood chemistry seminar is so essential. So I know one of your mentors was Dr. Harry Eidner, and maybe you could share with us how he developed the optimal ranges that he uses in his work.
It's more than a mentor. You know, when we talk about Dr. Harry Eidner, I think he's the genius. He is the Godfather, and I am actually, you know, when I sit here, I mean, I'm proud, I can say that I had the privilege to work with him. So when I teach blood chemistry, when I talk about blood chemistry, I actually, whatever I say is I learned from him, and
Sure.
I'm proud to say that. Now, see, one of the things people have to understand that the blood chemistry, I know there are other teachers teaching it and there are other programs out there, but practitioners, physicians need to ask the doctor who's teaching it, where did you come out with all this system? What is it about? I mean, how did you derive all that?
Sure.
The values and what you're teaching about. See, if you look at the history of what we are teaching, what our program is about is, it basically took years from 1977 to 2013. Dr. Harry Eidner was involved with over 1,000 practitioners and 10,000 patients. So all sorts of, from SMAC, from CBC, electrophoresis, all hormone analysis, all these were done with working with the 1,000 doctors based on patients' symptoms, history, pathology findings, you know, blood chemistry analysis. All that was put together into a program which we are teaching, which we call is based on algorithm method.
Why should clinicians use blood? I mean, what's the difference? Why is it important?
See, one of the things to understand is that the clinicians, you know, the whole practice is based on what the consumer is coming for. So if you look at in the medical industry, the gold standard for diagnosing a condition, pathology, is blood chemistry. So people believe what the blood chemistry is showing is what the disease is about. But let's take to a next level. Imagine using the same blood chemistry for a proactive patient, people who are trying to improve their health and they want to maintain their health. So I think for a practitioner, for a physician, if they can diagnose something which is an underlying cause and provide based on the blood chemistry testing that based on your blood, I have evaluated you and I can tell you that if you don't make lifestyle changes, you are going to go towards a pathology later on. So I think one of the advantages which we have with the blood chemistry is people trust blood chemistry. People believe that it gives them accurate things, and which is true. It's a gold standard. So now we have integrated blood chemistry evaluation system.
Now, you just came back from the Philippines,
Yes.
and you had Queen Marco.
That's
She
right.
wanted to hire you for services when you did the
Yes.
blood test.
Yeah, that was fascinating. You know, I was with the former First Lady, Imelda Marcos,
Okay.
and you know, prominent worldwide figure, and she clicked with me. She had 6-7 physicians with her, and 2 of them from Boston Harvard Medical School.
Okay.
So we were discussing, because she's, you know, looking, at the age of I think 87 now, she looks fabulous. She looks in her 60s.
Okay.
And so she is into heavy nutrition and all that. And we started chatting with some of her doctors. So we ended up having a dinner with her. So I looked at her blood chemistry and I gave them some suggestions. And at the end of the session, she basically wanted me to hire me on the spot, basically, to run all her hospital system, because she said her doctors are not trained in this type of thinking. They're giving her this vitamin, that vitamin, but she never knew that there is a model which exists which can figure out an underlying pathology, or which can figure out an underlying what is optimal for a person to take.
Now, speaking of optimal, there's this huge range of controversy these days about what is an optimal range.
Right.
And, most physicians have been taught in medical school that when it's outside the laboratory range, it's two
Right.
standard deviations outside the mean.
Right.
2 standard deviations is 95%.
That's right.
So if you have that means if 2.5% at the low end and 2.5% at the high end.
That's right.
I don't want to be
That is
close to
right.
that edge.
See,
So those optimal ranges are important.
I think this is where we need to work for. We need to work for that we can tell people that they are progressing towards a certain condition, or the blood is, if they don't optimize their values, it's going to go into a certain disease state. Why not prevent it? It can actually not only help the clients, your patients, it can actually change the model paradigm which we have in our healthcare industry right now.
I really like the words predict and prevent. We're
right.
looking at the
That's
values, we're predicting what will happen if they don't change the way
That's
they're
right.
going.
That's
they're
right.
gonna have a
That's
problem.
right. And this concept is very clear. If you look
is.
at people
It's
in
very
sports, fitness, everything we talk about, we go into how to keep our optimum fitness. How about our chemistry?
Yeah.
That regulates our heart function, brain function, how we feel, how we age. How about having a model which optimizes our chemistry? That's our blood chemistry. So this model which we have with our integrated blood chemistry, it really goes to the core health issues, how to maintain wellness.
Can you give me an example of the difference between a linear program versus an logarithmic program?
Joe, I'll explain you in a very simple way. Think that in real life, when we see somebody bright or brilliant, we call, and somebody who is not brilliant, I shouldn't say, we always think of somebody who can handle complex tasks, and there are people who just linear thinking. We use that term.
Okay.
This person is just stuck in the linear thinking and cannot figure out or get out of the box. Algorithm in my mind is outside the box. It's taking complexities of our physiology and blood chemistry and analyzing all markers at the same time. So it's not just this is high, you need this is low, you need this. That is basically one of the childish or immature way of looking at the physiology, because our physiology is very complex. And for complex physiology with billions of reactions going on, you need a model which can analyze all these multiple reactions, look at multiple factors, and then come out with a suggestion what a client needs.
Well, can you give us a specific example of an logarithmic calculation? What would be? Can you think of something?
Let's take a simple example. If your uric acid is decreased,
Okay.
and then a linear model will say take B12, but an algorithm method will say, do we need B12 or we need molybdenum?
Right.
How do you calculate that? That is where in algorithm system you will be looking at MCV, MCH.
Okay.
If they are normal or high, then it will suggest molybdenum.
Okay.
So if that is low, then it will suggest basically only B12. But in a linear model, you cannot calculate all the other factors in place, because it's looking at only take this is low, take this, which is actually not going to help the clients, because physiology does not function that way.
So what we're really talking about, Dr. Eidner has developed a system, and there's a manual that goes with it. But also, more recently, in the last 2.5 years, he developed a software program, and this is the third upgraded version of that software program. So we're talking now about a software program that makes these calculations. You don't have to do them by hand anymore.
That is right, and that is what it has made. All this years and years of knowledge has been put together of thousands of doctors, 10,000 patients. All that information has been put together into a software which a practitioner and a physician can launch easily into their practice and provide a proper service. And basically the new system can be downloaded automatically if you're using professional co-op services, or if somebody is using any other lab, the doctor can actually just punch in all the SMAC 27 or Opti plus D type panels into it, and then it guides the practitioner what to recommend for the patient. It guides the practitioner. For the patient also, it gives an explanation why they need what they are taking. So it goes into all the detail and it's all automated, makes the practitioner's life easy, and also helps the client to understand why they are taking what they are taking.
See, the beauty of that is, to me, we all learn things in seminars, postgraduate seminars, and we read journals and things, but to have what I'm going to call the Godfather of blood chemistry give you his perspective.
That's
now
right.
you can take your perspective because you're seeing the client, face to face, and you get the face to face contact. But to have his input right there is amazing.
It's amazing. It's amazing. See, practitioners and physicians don't realize if they start utilizing their system, it can open the doors. It can totally open the doors. And the type of clients which I see, only what I utilize, that what makes me stand out. Because it's impossible for any physician or practitioners to say that I can memorize everything about blood chemistry, about everything physiology. It's impossible.
It is impossible.
That's right. And now we have a software which can do a detailed analysis, go to the underlying cause, and then gives the guidelines to the practitioner how to proceed from there.
Yeah.
There is no value which can be put on that, the information.
Seminar attendees get the blood chemistry software with registration. The software alone is worth more than the cost of the seminar. And with this software, there are no monthly fees. There's a link on this page to a sample blood chemistry report generated by the software. There are links to a seminar flyer and links to register. Also, check out the video below by Dr. Harry Idenier, the software's developer. He shares the thinking behind his work and why it's unique. I personally use his blood chemistry analysis, especially with my tough cases. It's like being personally coached by Dr. Idenier. And using the printed reports can improve patient compliance and confidence in your recommendations. Take a few minutes, check out the links, and register. This weekend seminar is definitely worth any long drive or even a flight. Thanks for watching, and I'll see you next Tuesday.